Goday, please take it away.
Well, good evening, everybody. Welcome to the Medicaid 101 presentation. I did do a lot of my professional work working with Medicaid, and so today I'd like to share a little bit of what I learned about Medicaid with the SMP volunteers and the staff here. Often, at least in my experience, when one speaks with me about Medicaid, they would interchange the word Medicare, Medicaid. And for the general population, I think they're often confusing the two, and so hence on the Medicaid 101 presentation, I've written, is it care or is it CAID? And I'm guessing everybody can see the PowerPoint presentation. Okay, good. All right, so with that, I think what you're going to learn today is how Medicaid and Medicare intersect in ways that maybe you weren't aware of before. So with that, we're going to get started with the presentation. And okay.
Okay, now it's working.
Okay, so first, let's discuss what really is Medicaid. And the bullets here are outlining what Medicaid is. It's a healthcare entitlement public assistance program. And you hear that term entitlement thrown around a lot. And when the Medicare and Medicaid programs were originally enacted by Congress, the entitlement was that if once you're eligible for the services, you're eligible for the services. Entitlement in the more recent years has come to mean that you're not paying into it, but you're getting something out. So, especially with Medicaid, once you're enrolled, you're enrolled because you meet the income criteria for that population, and therefore you're entitled to the services of Medicaid. Medicaid was established in 1965 by Title 19 of the Social Security Act, and if you recall in our training in our SMP training, Medicare is Title 18 of the Social Security Act. So Medicaid, Title 19. There are no limit to the number of enrollees with Medicaid. If you meet the income criteria, you're eligible. Medicaid is funded with both federal and state funds. And the federal funds are often called FMAP, and FMAP is the Federal Medical Assistance Percentage. And sometimes you hear FMAP interchanged with FFP, which is the Federal Financial Participation. And just a side note here, the acronyms are all at the end of the PowerPoint presentation, so I'm not going to give you a test on what they mean or give me the definition because they're located at the end of the PowerPoint. That being said, Medicaid is both state-funded and federally funded, different from Medicare in that that's totally federally funded. However, Medicaid is governed by the Centers for Medicare and Medicaid Services, just like Medicare, but the Medicaid programs must have an approved state plan. So CMS approves not only the services that are delivered, but the reimbursement methodology for those services, and those are covered in the individual state plans. Each Medicaid program is a little bit different because of the services that are covered, as well as the reimbursement methodology. So often you hear that when you've seen one Medicaid program, you've seen one Medicaid program. The last available information that's compiled and publicly available is for state fiscal year 2012. And for state fiscal year 2012, the Louisiana Medicaid program expenditures were $6.6 billion. There were 1.3 million enrollees on the rolls of Louisiana Medicaid, and that represented about 30% of our population. In addition to the $6.6 billion, there was also $664.6 million in uncompensated care cost. Often you hear on the news or in the newspaper they talk about UCC cost. Uncompensated care is paid to those hospitals in Louisiana that have met a predetermined threshold for serving the poor. So the hospitals in Louisiana that qualified for uncompensated care were the LSU hospitals, because they are public, the Department of Health and Hospital inpatient psych facilities. There were also private hospitals that met the threshold for serving the poor, and those were reimbursed for their uncompensated care costs. And subsequent to Hurricane Katrina, there are certain New Orleans facilities that now qualify for uncompensated care costs. So who actually is enrolled in Louisiana Medicaid? There are two automatic qualifiers for Louisiana Medicaid. If one has been determined by the federal government to be eligible for Supplemental Security Income, or SSI, that eligible is automatically enrolled in Louisiana Medicaid. The Louisiana Medicaid program receives an electronic tape once a month from the federal government, and it loads those SSI eligibles onto the Louisiana Medicaid roll. In addition, another automatic qualifier are families that are identified through the Louisiana Department of Children and Family Services as recipients of the Family Independence Temporary Assistance Program, and often that's referred to with an acronym of, FITAP. And the Department of Children and Family Services sends an electronic tape once a month to the Department of Health and Hospitals, and those individuals are automatically enrolled on the Louisiana Medicaid file. All others must fill in an application, and they are income tested to see if they meet the income criteria for enrollment in Louisiana Medicaid. And the different groups here are if you're over the age of 65 or over, if you're blind, and that would be a corrected vision of no better than 20/200, you would be a family with children, the disabled, and some group that a lot of people have never heard of is the breast and cervical cancer individual. And if you were screened by the state of Louisiana's Office of Public Health and you were found to have breast or cervical cancer and you meet the income criteria, you can become Medicaid in Louisiana Medicaid eligible. And finally is the LCHIP program, which is the Louisiana Children's Health Insurance Program. Those groups all are required to fill in applications, and a determination is made whether you meet the income criteria or not. Yes, question.
Yeah, I'd like to find out if this is permanent. Once you indicated, I think, in the beginning that once they qualify, that they're always qualified?
On an annual basis, they must reapply, and a determination is...
They have to meet the criteria, whatever they happen to be, every year then?
Yes. States do establish eligibility income limits, and so within the federal guidelines, each state, remember what you've seen one Medicaid program, you've seen one Medicaid program, each state can set the income limits for their eligibility groups, and the state determines what income counts towards that limit. And it's based on family size and income compared to the federal poverty guidelines. A few examples of who would be Medicaid eligible in Louisiana. The eligible person is underlined, so in the next 4 bullets we'll have some examples, but only the person or persons that are identified with the underlining is that person which is Medicaid eligible. So in the first bullet, we talk about a 1-year-old only child living in a 2-member household with an annual income between $20,123 and $30,260. That 1-year-old child is Medicaid eligible under the LeChip program, only the child. Or you could have a 2-member, a parent and a child household with $123 monthly income. There's no asset test limit for that parent and child, and that would qualify under the Life C eligibility category.
And their income could only be $123 a month?
Yes.
You couldn't buy groceries on $123 a month.
Oh, well, they'll get food stamps.
Oh, no, sorry.
Yeah. The other
So,
that's right. Now, that's for Louisiana. Under a Life C in any other state, that could be quite a bit higher.
did these combine?
What do you mean combined?
Well, in other words, a pregnant woman in a 2-member household. Would that be also the second one, 2-member parent and child household?
They will qualify under one or the other.
Okay.
Yes. So the next bullet, we're talking about a pregnant woman in a 2-member household with an annual income of less than $30,260. That pregnant woman would qualify under the LaMoms program, which is an eligibility category so that we can get pregnant women covered and they can have health insurance. That 2-member household can be a mom and a child, or it can be a mom and her husband. But only the pregnant woman would have the Medicaid coverage under LaMoms. And finally, the last example is a non-married nursing home resident with annual income of less than $25,132, and the state of Louisiana allows an asset limit of $2,000, and that nursing home resident would qualify under the long-term care eligibility group. Those are a few examples. There are many more, but I wanted you to see the differences between eligibility groups and the income that is associated with making one or allowing one to become enrolled in Louisiana Medicaid. So how is Louisiana Medicaid financed? I know in our training for SMP we talked about the Code of Federal Regulations. The Code of Federal Regulations also governs the federal financing formula for Louisiana Medicaid, and it's based on the Federal Medical Assistance Percentage, that FMAP that we talked about. FMAP or FFP for states range from 50% to 83%. And by that I mean the richer states, I think New York is one of the richer states that qualifies under the 50-50. For every dollar in reimbursement to providers for a Medicaid eligible, New York State puts up 50 cents and the federal government puts up the other 50 cents for that reimbursement. The poorer states have a higher reimbursement allowable at the federal level. According to the federal regulations, it can be as high as 83%. Louisiana regular Medicaid FMAP for state fiscal year 2012 was approximately 70%. So for every dollar that Louisiana Medicaid reimbursed providers for services delivered to a Louisiana Medicaid eligible individual, the state of Louisiana put up 30 cents and the federal government put up 70. That was lower, that 70% was lower subsequent to Hurricane Katrina. Prior to Hurricane Katrina, we were about 75% federally matched. A lot of the poor in New Orleans left the state, so our per capita income rose, and our federal medical assistance percentage dropped. LeChip, however, is matched at a higher rate because the federal government and remember LCHIP is the Children's Health Insurance Program for kids here in the state of Louisiana. The federal government was giving incentives to all states to enroll those children that qualified for CHIP, and so the federal government enhanced the FMAP for those states to get them enrolled. The next bullet talks about family planning. Now this is not an eligibility group. This is a service that I'm referring to here. So family planning services for all states, spelled out in the Code of Federal Regulations, says that the federal government will match family planning services at 90%. So for every dollar in reimbursement to providers, the federal government kicks in 90 cents. The federal government also has a matching rate to administer the Louisiana Medicaid program and every other state's Medicaid program. And the administrative match for this would be salary, supplies, incidentals that are related to administering the Medicaid program. The federal government matches that at 50% unless the individual is a skilled professional, medical professional, and that person's salary, anything associated with that person is matched at 75% because this is a health care program. So physicians, nurses, pharmacists that are administering the Medicaid program, the federal government matches their salaries at 75% and the state contributes only 25%. On an annual basis, annually, when the legislature comes into session in Baton Rouge, as aggravating as that can be, that they do every year have House Bill 1, HB 1, which is the appropriation bill for the entire state. HB 1 for state fiscal year 2012 allocated the following funds for the Medicaid program. They allocated, there is a line item for reimbursement to private providers, and for state fiscal year 2012, that appropriation for private providers, which are the pharmacies, the doctors that you and I see when we seek health care, that was $4.5 billion. There's also a separate line for reimbursement to public providers in the appropriation bill, and that was $726.8 million. Public providers are those charity hospitals in the state of Louisiana, as well as any hospital that is owned by the parish. There are a number of parishes in the state of Louisiana that own their own hospitals to assure there's health care provided in their parish. So those are public providers as well. The next bullet is the first time we're going to talk about the intersection of Medicaid and Medicare. There is a line item appropriation in Louisiana appropriation bill for Medicare buy-ins and supplements. And you see that $757.5 million was actually an appropriation greater than what's appropriated to reimbursing the public hospitals. And we're going to talk a little bit more in depth for the Medicare buy-ins and supplements in just a second so that we fully understand, or I can at least, I don't know that we'll ever fully understand what that is, but we'll have our first taste of how Medicare and Medicaid intersect. And then finally, the separate line item in the appropriation bill is the uncompensated care costs that are paid to those hospitals that serve the disproportionate share of poor. So remember that line item appropriation, Medicare buy-ins and supplements. The state legislature appropriates money on an annual basis so that Louisiana Medicaid can pay premium payments to the Centers for Medicare and Medicaid Services on behalf of dual eligibles. A dual eligible is a person that has Medicare and Medicaid, so that they can pay premium payments to CMS on behalf of dual eligibles for Part A, B, and D. D is often called the clawback, and we're going to put that on the side burner for right now. We're going to talk a little bit about clawback in a little bit, but for right now, just keep in mind that Medicaid does make premium payments to CMS for Part A, B, and D. Those premium payments allow the transfer of some of the medical costs from the dual eligible population, it transfers the cost from the Title 19 Medicaid program, which is partially state funded. So remember, the state kicks in some money. And we can shift those costs to the Title 18 Medicare program, which is fully federally administered and funded. And so we can save some state dollars by paying those premium payments and shift that payment first to Medicare. The other positive about making those premium payments is that the federal government, as allowed in the Code of Federal Regulations, also matches those premium payments. So federal dollars are out there to match those premium payments to assist Louisiana with the premium payments for certain buy-in enrollees. Buy-in enrollee meaning we're buying into Medicare for those dual eligibles.
Can I ask a question?
Sure.
So that means that those of us that paid in Medicare would be paying for people that did not pay in Medicare. Can I make that assumption?
No, I don't think you can make that assumption.
So you're transferring 18.
They will have paid in, but they maybe just can't pay their premiums. So if they're low income,
I understand.
Okay.
Wait, let's just make sure everybody else heard. That was Manuel was asking a question. His question was to, he wanted to see if people who were paid for Medicare were their money was being used to pay for people who had not paid into Medicare. And what Kay clarified was that the connection between the Medicaid and Medicare is that the individual covered by Medicare has paid into the system through their taxes, during all this time through Social Security, but they may not, because of their current situation, be able to pay that Part B premium, and Medicaid is coming in and picking up that as well as some of the other costs.
That's correct. So we talked about a dual eligible. This slide is just to reinforce that a dual eligible is an individual that's entitled to Medicare and is eligible for full or partial Medicaid benefits.
Connection.
You want to ask that question again?
No, I said I just didn't see the dog thing.
Oh, okay. Okay.
Sorry.
So dual eligibles, you can either be fully dual or you can be partially dual. A full dual eligible is okay, let me start with the first arrow. Medicaid pays the Part B premium for certain low-income full duals. And Medicaid pays the Part A premium for those receiving SSI payments who became enrolled in Medicare at the age of 65. The Medicare beneficiary is eligible for full Medicaid services. And Medicaid will pay the deductible and coinsurance, if it's applicable, for the Medicare services. And in addition, Medicaid may cover other Medicaid services not covered by Medicare. An example would be the non-emergency, non-ambulance transportation. And anyone not familiar with the Medicaid non-emergency, non-ambulance transportation, those may be the vans that you see on the streets that bring individuals to the doctor, their doctor's appointments. That is a Medicaid covered service. It's not a Medicare covered service. But for a full dual who has no other way to get to the doctor, Medicaid would pick up the coverage for that service to get them to the doctor. An individual could be without full Medicaid coverage, could be a partial dual, where Medicare beneficiary does not qualify for full Medicaid services. And Medicaid assists with the Medicare premium and cost sharing. Another intersection point between Medicare and Medicaid is the Medicare savings programs for dual eligibles. We're still talking about that line item appropriation where it talked about Medicare buy-ins and supplements. The Medicare savings program comes under that line item appropriation. Medicaid program provides help for people with limited incomes to pay their Medicare premiums. And in some cases, it pays Part A and B deductibles and coinsurance. And the Medicare Savings Program helps millions of people with Medicare save money each year. There are 4 Medicare Savings Programs, and we're going to talk a little bit more in depth about each one of these 4 classifications in just a second. But for right now, they are the Qualified Medicare Beneficiary, the QMB. They're the Specified Low Income Medicare Beneficiary, often called the SLIMB. They're the Qualified Individual Program, the QI1. And then there's the 4th one is the Qualified Disabled and Working Individual, QDWI Program. Louisiana Medicaid is responsible for determining eligibility and enrollment into the Medicare Savings Program. To qualify, a person must meet, they must have Part A, they must be an individual with limited resources set annually by Medicare, and the individual or the married couple must have income less than the threshold established by Medicare. So Louisiana Medicaid makes that determination, but the criteria is established by Medicare. Just briefly about the QMBs, Medicaid pays the Part A, B, and D premiums, some deductibles and coinsurance for Medicare-covered services. The income limit is up to and including 100% of poverty. For an individual, that would be $11,100. The asset limit established by the federal government is $69.40 for an individual, or $10,410 for a couple, or twice the SSI eligibility limit.
May I ask a question?
Sure.
I'm seeing here where it says, pays the Medicare Part A. But aren't there just very limited number of beneficiaries that have a Part A premium? Isn't that, for the most part, hasn't that been paid during your work years or your years prior to 65 for most people? Am I wrong about that?
You still pay premiums.
You pay a Part A premium?
Mm-hmm. I'm pleading ignorant. I don't know.
Somebody help me out there. All of you beneficiaries out there. Y'all pay a Part A premium as well as a Part B premium?
No, your Part A was it was FICA. What they're saying is that is a dual eligible who has not paid in their quarters because Medicaid covers people under 65.
Okay, so they haven't gotten to that 40 quarters, but that would be the much smaller percentage of individuals.
In Louisiana, it's a pretty good percentage.
Thank you, Marietta.
What do you mean by savings programs?
They're just calling that a savings program.
It's just a name.
Yeah, yeah. It's certainly not an account anywhere that. And then the next group was the Specified Low-Income Medicare Beneficiary. Medicaid pays the Part B and D premium. The income is a little more. It's between 100% and 120% of poverty, and the asset limit is the same as the QMD. The QI1s, Medicaid pays the Part B and D premiums with 100% federal dollars. On an annual basis, Louisiana is given a limited pot of dollars, and when it's gone, it's gone. The income limit is still a little bit higher. It's 120 to 135% of poverty. The asset limit is the same. And then finally, the Qualified Disabled Working Individual, Medicaid pays Part A premium for the non-aged individual who lost SSI disability benefits. It's income up to 200% of poverty. And the asset limit is a little different. It's $4,000 per individual or $6,000 per couple.
Does that include your home?
In some cases it can include your home, and in other cases it does not. And that's all spelled out in the state plan that's approved by the federal government.
Most people either rent or have a mortgage.
So I promised that we would talk about clawback, Medicare Part D clawback. These are mandatory state dollars paid to the federal government to finance the Medicare prescription drug coverage offered under Part D for certain Louisiana dual eligibles. The amount that Louisiana and every other state must pay depends on a set of guidelines that the federal government established under the Medicare Modernization Act of 2003, the MMA, that established Part D. So when the legislation was enacted during the debates about offering Part D, everyone realized that pharmacy benefits in almost all cases was a Medicaid service for dual eligibles. And because the federal government said, well, you states have been paying for pharmacy coverage for these dual eligibles, the state's share of that money that you have been paying for those dual eligibles should now go to the federal government to help finance the Part D program. So there is a specific formula that each state must follow and pay the federal government all state dollars to help finance the Part D program. For state fiscal year 2012, those state dollars for Louisiana amounted to almost $92 million. That was a payment made to the federal government to help finance Part D coverage for the dual eligibles. So a sizable amount of money. That also is appropriated in that Medicare buy-ins and supplements in that appropriation line. So what are the services that Medicaid provides? There are mandatory state plan services that the Code of Federal Regulations say each state must provide. And they are very specific services. In addition to those specific services, there's a statement that says any service deemed medically necessary for an enrollee under the age of 21 must be provided. And this can cause states a lot of heartache. That one sentence that says, even though it's not a mandatory state plan service, if it's deemed medically necessary for someone under the age of 21, states must provide it. My own individual experience with this, on 2 different occasions, we had children, there's something specifically in the Code of Regulations that says that Medicaid cannot pay for experimental procedures. And on 2 separate occasions in the state of Louisiana, we had children that had to have this experimental procedure. It was life-saving. And initially that service was denied under the provision that it was experimental. And once that service was appealed, anytime a service is denied in the state of Louisiana to a Medicaid eligible, that recipient or Medicaid eligible has appeal rights. And once that was appealed and it went up the chain of command, we realized that that service, once it was deemed medically necessary for that child, and in these 2 cases that I was personally involved with, life-saving, Louisiana Medicaid had to pay for that. It can get very expensive, and so that's something that you just have to have an appropriation for. You don't know if it'll be used or not, but that caveat is in the Code of Federal Regulations that says anyone under the age of 21 must be provided the service if it's deemed medically necessary. So in addition to mandatory state services, there are optional state plan services, and then there are waiver services. The mandatory state plan services include inpatient and outpatient hospitals, family planning, rural health clinics, federally qualified health centers, lab and x-ray, long-term care, physician services, nurse practitioner services, nurse midwife, home health, and durable medical equipment. All those are expressly stated in the Code of Federal Regulations, so every state you will find those services provided by every state. The optional state plan services that states are allowed to either include or not include in their Medicaid state plan include pharmacy, in- and outpatient mental health, dialysis services, certified registered nurse anesthetist, hospice, dentures, adult dentures, and medical transportation, emergency and non-emergency medical transportation. Louisiana does, at this point, cover those optional state plan services. Every year during the appropriation bill debate, you'll hear discussions about whether any of those should be omitted. And I think the last legislative session, the thing that was debated most hotly was the hospice Medicaid service. It was left in. It was finally, there was money appropriated to continue covering hospice. But right now, all those are Louisiana optional state plan services for Medicaid. And then waiver services are optional, but they do require approval from the Centers for Medicare and Medicaid Services. They're called waiver because they're exceptions to the traditional Medicaid service, thus, hence we call them waiver. They waive the federal regulations. It allows states to test creative alternative services which could prove to be cost neutral. Home and community-based services are designed, home and community-based waiver services are designed for the elderly, the physically, mentally, or developmentally challenged individuals, and waivers typically have a limited number of slots as a cost control measure. There are 2 elderly waivers in the state of Louisiana, adult day health care, and you'll see some information there about adult day health, and then the community choices waiver with the number of slots and expenditures for each, and some of the services that are provided in each of these elderly waivers.
These are some of the services that Louisiana cut with the last budget. Some of these waiver services.
And they look at these every year. There usually are there are a lot of people that show up at the Capitol in certain colored T-shirts to advocate for funding these waivers. So there's always a lot of discussion about waiver services.
So these can change from one fiscal year to the next?
The reimbursement may change, but the services, once they're in the state plan, the waiver period is a 2-year period, and to get rid of them would be very difficult. You can adjust the appropriation so that the reimbursement for services could change, but to get rid of the waiver during that 2-year period would be difficult. And then the developmentally disabled waivers, there's 4. You see the appropriated amounts there with the slots and the services that are available for the developmentally disabled. This is probably, of the waivers, this is the most active population. Parents are very involved. Yes, they are very aggressive, and for me, for one, there's never enough slots. There are never enough slots. There are a long waiting list for all the DD waivers. It's unfortunate, but there's never enough money. And you'll see why there's never enough money shortly. But with this pie chart and the next pie chart is important because this pie chart, we're talking about the who. And this is identifying member months by eligibility group. And a member month, what I mean is if I'm eligible for Louisiana Medicaid for 12 months, I contribute a 12 to this pot. If Julie's child is eligible for Medicaid, but only for 6 months, then Julie's child would be contributing 6 months into the children's part of this pie chart. So these member months represent 12 months of how those that are enrolled in Medicaid, what am I wanting to say? The total number of member months covered by Louisiana Medicaid for those eligibility groups. So you see that Children make up about 58, you can't see, but take my word for it, it's about 58% of the member months. The elderly and disabled, the blue and the yellow part of the pie chart, make up for about 27% of the member months. And that's what I want you to remember, is the blue and the yellow, because the next pie chart is going to show expenditures. So we're looking at the blue elderly and yellow disabled representing 27% of the member months. But the next pie chart, we're looking at the payment side. So that 27% of the population that made up the member months are now accounting for about 67% of the expenditures. So although we cover a lot of children, children aren't expensive. They're in the orange group. But the disabled certainly make up about 50% of the expenditures in Louisiana Medicaid, and then the elderly make up about 27 more percent. I like these two pie charts because it does show where our eligibility stands and then where our payments go.
Yeah, what's the age of the children?
Up to the age of 21.
So they can just jump to another color?
Of course, there's different eligibility criteria once they make 21. Sometimes they fall off of the eligibility altogether, and Medicaid has been accused of, once a child turns 21, they turn into a pumpkin because they can lose eligibility. A foster child is an example of that. So they could move into another eligibility category, or they could move completely off the eligibility.
So at that point, they would have to develop their own eligibility.
They would have to qualify. They would have to qualify under an existing eligibility group. And Louisiana Medicaid tries very hard for continuous coverage, but because of specific criteria, if you are not eligible, you aren't eligible.
But it's possible that some of those children could find themselves in a situation where their income is such that they've moved out of the system.
That's right.
Correct?
Could be. Could be. The thing that's new in Louisiana Medicaid is managed care. Louisiana Medicaid managed care is called Bayou Health. There are currently 3 prepaid plans operating in Louisiana, prepaid meaning the HMO type operations, and there's 2 shared savings plans which are still fee for service. So you go to the doctor gets paid for his fee, but that organization must demonstrate savings by managing the care, and then the organization as well as the state share in the savings. There were 900,000 Medicaid eligibles transitioned to managed care in 2012. The important thing here is that dual eligibles are exempt from Bayou Health.
So where do they get their Medicaid from?
They're still in traditional Medicaid, fee for service. There may be at some point in the future they're looked at to go into managed care, but they wanted to cut their teeth on the non-dual population first. Medicaid is always the payer of last resort. That's not Louisiana's choice. That's by the Code of Federal Regulations. Every other payer must pay first before Medicaid is accessed. So Medicare and supplemental payments must occur prior to Medicaid. Medicare and supplemental carriers typically have their claims electronically submitted for the dual eligible population to the Medicaid fiscal intermediary for payment consideration. Why that's important is because if the claim fails to electronically cross over to Medicaid, then the medical service provider is responsible for submitting a paper claim. And the reason I'm getting in the weeds on this is because that's very important for the next bullet. Medical providers, according to the Code of Federal Regulations, only have 6 months from the Medicare date of payment to meet Medicaid timely filing requirements. So if that claim fails to electronically process over to Medicaid, the provider is responsible for submitting a paper claim. If the timely filing requirements are not met, the provider cannot seek payment for coinsurance or deductible from the dual eligible. When the claim does cross over to Louisiana Medicaid, Medicaid will cost compare the Medicare payment to the Medicaid rate, and if Medicare payment exceeds the Medicaid rate, Medicaid's going to pay that claim at zero. The provider cannot seek payment for coinsurance or deductible from the dual eligible when zero payment is made. So at the beginning of each new calendar year, a similar crossover claim that paid at zero in the previous calendar year may now be paid at the Medicaid rate because the new year deductible had not been met by the dual eligible. The provider may not seek additional payment from the dual eligible because Medicaid payment is always payment in full. So the most important thing here is the last bullet. Any questions from dual eligibles regarding crossover payments should be directed to Medicaid staff for research and resolution because of the complexities of dual, full dual, partial dual, whether the deductible was met or not, whether the service is covered or not. Medicaid staff is fully educated on how to research these and make a determination of whether the payment was made correctly or not. Always for dual eligibles, having questions about whether the claim paid or not, or whether the provider was right in seeking additional payment from the dual eligible, should be turned over to Medicaid for resolution. And we're going to have some examples here just so that this may become a little bit clearer, or it can muddy the water, one or the other. So in this example, we've got a full dual eligible that sought care in the physician's office. The physician office billed $200, and we're talking about fee-for-service here now. We're not talking about Part C or anything else. We're talking about just Part B, fee-for-service. So the physician office billed $200. The Medicare allowable was $100. The Medicare payable is $80, and the coinsurance is $20. The patient has met the deductible. The Medicaid rate is $50. The claim crossed over to Medicaid. Medicaid recognized that Medicare payment of $80, and it's greater than the Medicaid rate of $50, so that payment 80 is greater than 50, so Medicaid paid that claim at zero. The provider cannot seek any additional reimbursement from the dual eligible. That payment is payment in full.
May I ask a question?
Yes.
I know that for Medicare, doctors have to enroll. They have to agree, you know, to Medicare assignment. They have to. Do doctors also enroll for Medicaid?
Doctors do enroll with Medicaid, but they can choose to accept the patient as a Medicaid patient or not. But once they accept that patient as a Medicaid patient, they can't pick and choose which services they're going to bill Medicaid for. They accept that patient as a Medicaid patient, and if it's a Medicaid covered service, they must bill Medicaid regardless of the reimbursement. But they are required to enroll with Medicaid. They can establish that, and I have seen this happen, where they say, I'm not going to accept any more than 10% of my patients as Medicaid. So once they've reached that threshold of Medicaid patients, they can say, I'm enrolled with Medicaid, but I've reached my threshold, and I'm not accepting you as a Medicaid patient. But if they're below that threshold and they accept that patient as a Medicaid patient, then they must bill Medicaid for the Medicaid covered services. So we have another example where the deductible had not been met. Same full dual eligible, same physician office visit, $200. The Medicare allowable is $100. The Medicare payable is $80 again with the coinsurance of $20. Like I said, the patient had not met their deductible, and so Medicare paid $0 on that claim because the deductible had not been met. The Medicaid rate is $50. When that claim crossed over to Medicaid, Medicaid saw no payment was made, so then Medicaid pays $50, which is the Medicaid rate. The provider cannot seek additional reimbursement for that dual eligible for any balance because that payment of $50 is payment in full. I have Medicaid contacts here, the website. There's a live chat available on a link on the website. There's a phone number. And as I promised, there is glossary and acronyms that go on forever. Oops, sorry.
Not quite.
Not forever, really. But that's the end of the presentation. I hope there was some small part that was interesting and informative. And if there are any questions.
I have a question.
Okay.
If the major criterion for this is income, what is the determinant for deciding what the income is? Is it state and federal income tax forms?
That's spelled out. The state determines what income is going to be counted, and in certain situations it may be for, you may have to submit your monthly payroll stub.
It would seem to me the reason I asked that it would be wide open to fraud, particularly for these folks who are paid in cash for whatever they do and declare no income and pay no income tax.
If they declare there's no income, I didn't grow up on the eligibility side, so I can shoot from the hip there, which could be dangerous. I grew up on the service side. I would imagine if they did this, they would have access to validate their statements, but you know, I don't know.
I understand how the state, the legislature set it up, right? That's how it's funded. How does the federal government, where does the money come from?
I would imagine there is a line item appropriation in the at the federal level as well.
So it's not funded. In other words, it just you get a bill and then you figure out where you get the money.
Help me a little bit with. Can you restate that
I'm
question?
saying Medicare, you pay payroll taxes, right?
But isn't Medicare also operating in a deficit?
Well, everything's operating. But what I'm saying on Medicaid specifically, you have all of these millions of dollars, so there's no tax on it. Nobody tax on it. But that's
well, we all pay federal income tax, and so I would imagine the federal appropriation for the match at the federal level is from any taxes that anyone, a person or a corporation.
So it's just not dedicated.
No, it's not dedicated.
In other words, you have a hurricane, you got to figure out where you get the money.
Right.
So why not dedicated? Is just a congressional thing? Is that?
You're getting above my pay rate.
To me, everything is simple if you know where the money is going to come for any specific expense. But
well,
that would be maybe.
You know, I guess how my eyes were opened was subsequent to Hurricane Katrina, Louisiana was given $100 million to help build the healthcare system back up in the state. So I was appalled that we could just, you know, federal government could say, here's Louisiana, here's $100 million, tell us how you're going to spend it. So undoubtedly there's enough money floating around at the federal level that.
No, actually there isn't anymore.
Well, I agree with you. I agree. I agree there isn't.
No, but I'm just wondering if there was any way, because that's one of the questions that a lot of people ask. All right, so I'm on Medicare now. I'm not on Medicaid. Where does the Medicaid come from? And I don't have any answers.
But just tax dollars, right?
Yeah,
it's coming from tax dollars. Yeah. And our group here in the office has been quite vocal. What about you all out there? Do you all have any questions that you'd like to address to Kay?
Yes, this is Dee. Is there a possibility, I know you said we were going to have something after, that, you know, we would be able to go online and get this. This would be great to have this kind of a presentation just to put in one of my books. Is that a possibility?
Yes, I'll send, just like I do every month with the notes.
Yeah.
See, I'm going to send a PDF copy of Kay's presentation, her PowerPoint.
Oh, good.
Yeah,
Oh,
you'll get a
Okay.
copy of this.
Yeah, because I kind of got lost after the second line. I mean, but I've been taking notes, but I'm not sure I'll ever be able to read them again.
Yes, ma'am. Everybody will get a copy.
That's fantastic. And you'll make sure Liz gets one, too.
Absolutely.
Okay, thank you.
Any other questions in regards to any specific part, anything that Kay discussed here?
I wanted to ask a question about the asset. One of the assets, it was $123, but no asset limit. So does that, it's unlimited? So you can have 3 houses and but I just don't have to have any income. So does that mean passive income or a job? By passive income, I mean investments.
I don't know the answer to your question. I wish I did, but
But the assets are unlimited, right?
well, there's no asset test.
Okay, so the test doesn't mean.
They could have assets.
Yeah.
That's those dogs that were in there.
So folks, is that y'all are just a smart group? CK, you did such an outstanding job.
Well, she did. However, I'm going to go back to the state. What's allowed for the states? Is that based on, say, unemployment or national averages? Like you gave the example of New York versus Louisiana. Do we have more poor people, in other words, with no income?
We do, and yes, we do, and it's based on the state's per capita income.
Per capita.
Because, yeah, I know when the president was down here not too long ago, he was wanting Jindal to increase the Medicaid program, I guess. And I assume from that we must have a ton of poor people. Can't we send some of them to the other states?
Well, that happened in Katrina. Yeah, that's why that's why our federal match dropped. Is our per capita went up.
That was my other question on the eligibility. So because each state is its own and each program, so if I am let's say any of those beneficiaries there, I can move to a state that is more advantageous to me?
Absolutely. You could be not eligible for Medicaid in this state and move to Texas and become eligible because their income criteria is different than ours.
Of course, you would have to go through a program like this to understand each state.
And what I've heard, because of our limited numbers of slots on our waivers, that families that do have developmentally disabled children may make a decision to move to another state where there are more funded slots than actually Louisiana has. So, you know, people in desperate situations make decisions. That's right.
Anybody else?
This has been an exceptional presentation, and I'll tell you, I have learned so much, but, you know, I'll never put this all together like the lady did that's doing this. But I think it's a great presentation, and I thank you for your time and effort.
So you're welcome.
Yes.
Okay, okay, I'm thinking, Kay, it took you longer than an hour to learn this, huh?
It took me over 10 years to learn what I learned on the services side. Like I say, eligibility is not my expertise. What I know about eligibility, I picked up out of the annual report. But yes, And in fact, I am the expert on that claim payment. I had to cut my teeth on that when that was prior to one of our cost-cutting years. We implemented that cost compare for dual eligibles. Prior to that, we paid full co-insurance and deductible for every claim that crossed over, and there were millions of dollars and the federal government allows this cost comparison, so that cut was put in, and it's not one I'm proud of. I would rather pay full co-insurance and deduct for every claim, but the state of Louisiana did not have the money to continue to grow the Medicaid program at the level that it was growing, and so I was the one that had to put that logic into place. So
do you know if there's any effort such as ours to combat fraud in the system?
For Medicaid?
Yes.
There is not direct-to-consumer like ours. There is, in fact, I did work in Medicaid fraud before I went over to start doing the services side. There is a whole set of nurses, pharmacists that work in Medicaid fraud to try and identify aberrant billing from providers. But I've got to tell you that on the Medicaid side, just like the Medicare side, those guys have been way ahead of us on the curve on committing fraud. I learned a lot just in working on the Medicaid fraud side. And I think Aaron did a really good presentation. Aaron McAllister, one of my first presentations for S&P, Aaron did, talking about Medicaid fraud from the Attorney General's office, the Medicaid Fraud Control Unit. Medicaid separately has a unit. Bill Root has gone to work for Louisiana Medicaid now, and so he brings another level of expertise in fighting fraud. But we'll never get ahead of that curve, I'm afraid.
Yeah, that's true. That is true.
Well, if you all don't have any other questions, I think we're going to...
I have one more. How long does it take from the time a claim is sent in till the doctor gets paid? What's the time frame, ballpark?
If a claim is received by Tuesday, which is a cutoff date, the doctor will be paid the next Tuesday. Medicaid, we are, well, when I was working with Medicaid, we always said that we didn't pay really good, but we paid promptly. So if you got your claim in by Tuesday, you were paid the next Tuesday.
So your little check is going to come real fast.
That's right. You will get your turnover. Your turnover is really quickly. You're just not real happy with the amount of it.
Yeah, yeah. And I do have another question. If a patient is required to have some type of medical equipment, say an electric wheelchair or whatever, does Medicare rent those, Medicaid rent those, or does Medicaid buy that piece of equipment for the patient?
Both.
They do both?
Yes.
And what's the determination of buying or renting?
Duration. So if it's a short-term need, it would be rented, and then it would be just like, I think Medicare is the same way. If it goes beyond, at the point that we've rented to the price that we bought it, then it becomes a purchase.
And that is monitored carefully?
Yes. All durable medical equipment for Louisiana Medicaid is prior authorized. So well, I say all. If it's below a certain price, it's not cost effective to prior authorize it. But it is prior authorized, so when the request comes in, it's looked at for medical necessity. And then the prior authorization period is for no greater than 12 months. It could be less because the doctor does complete a certificate of medical necessity, just like with, I think Medicare requires a certificate of medical necessity too. So it's prior authorized. If they cannot get more than their monthly allocation, they can't, they can't bill me for can't bill Medicaid for 12 months if they're supposed to get 12 one-month supplies. But I've got to tell you, on the Medicaid side, there's a lot of fraud in durable medical equipment as well.
Yeah, yeah. Okay, thank you for those answers. I appreciate it.
Let me just say one other thing about if the claim comes in by Tuesday. The Code of Federal Regulations, state that 90% of clean claims must be paid by the Medicaid program within 30 days.
Okay.
90% must be paid within 30 days, and then the remainder paid within 90 days. So it has been talked about on the Medicaid side. Instead of turning over those claims as rapidly as we currently do, there could be put into place a cost savings to shove back that payment because we do pay on Medicaid pays on a weekly basis, shove back those claims payments for 4 weeks. And they talk about that at the end of every state fiscal year when money start running short. And they're talking about holding payments, which you still would be in compliance with the federal regulations, but they're saying, you know, if we hold back those payments and still be in compliance with the Code of Federal Regulations, we could save X amount of dollars. And all you're really doing is shoving it into the next state fiscal year, which doesn't help the next state fiscal year appropriation at all. But, you know, you're still borrowing from Peter. Yeah, that's right.
Okay, great. Thank you.
All righty. Well, we want to thank all of you all for joining us today. As we said earlier, we have recorded this, and I'm actually going to turn the recording on.